Hello friends, my name is Dr. Rama Nagpal and I will be talking to you today on the neonatal care to be provided during COVID times and the guidelines for management of our neonates. I'll be covering this topic under three headings: pregnant COVID mothers admitted for delivery, what should I anticipate and prepare for? The next topic would be the delivery of a COVID positive mother and what is the intrapartum and neonatal care that I need to provide. And finally, the newborn care to be given after hospital discharge. Now, when is a neonate believed to be exposed to COVID? Either when a neonate is born to a COVID positive mother with infection diagnosed within the last 14 days prior to delivery or up to 28 days after delivery. Or secondly, when a neonate is exposed to close contacts, which could be in the form of caregivers, family members, medical staff or visitors. In both these conditions, the neonate is believed to be exposed to COVID. So when a pregnant COVID positive mother is admitted for delivery, what do I need to plan and anticipate? First, I need to give appropriate isolation to the pregnant COVID positive mother admitted for delivery. So either she is already diagnosed as COVID positive or she suspects COVID positive. I need to look into the infection control practices and handling of PPE kits, etc. And I need to provide and think of strategies to protect a neonate from COVID. Now, what is the association between pregnancy and COVID? Pregnancy itself alters the body's immune status and the response to viral infections. While the incidence of the COVID infection is the same as the general population, it has been seen that the mother may be at risk, particularly in the last trimester, as has been seen in the previous outbreaks like the SARS and MERS. She may be a little more at risk. Pregnant mothers with heart disease are at increased risk for COVID infections, but more than that, it is the likelihood of the increased perinatal anxiety, maternal depression, domestic violence and certain mental health issues that we would also need to address in mothers. So the maternal anxiety due to an impending delivery and her worry whether the fetus would be COVID positive or the baby would be COVID positive also needs to be addressed by us healthcare workers. A word about vertical transmission. Vertical transmission is rare, has been seen in about approximately 3% of the pregnancies. There is no recorded case of vaginal secretions testing positive for COVID. There is no recorded case of breast milk having COVID virus. The long-term effects of this disease on the fetus are not known, and the risk of a neonate acquiring the infection during birth hospitalization has been virtually not reported unless due precautions are not taken. So the lesson here is that we need to take due precautions when the mother comes for delivery. So overall, to sum it up, vertical transmission is known but is very rare. Now when the mother comes, one of the things we need to do is to take a good medical history. Take a history of exposure to people with symptoms of COVID. Ask her a detailed travel history. Ask her for any symptoms of COVID. Is she coming from a micro-containment area or a hotspot area? And does the mother have any associated immune-compromised conditions? Once the mother comes in, she is tested. The ICMR has mandatory testing guidelines for all pregnant mothers who come to the hospital for delivery, and at that point she needs to be triaged. So she is either confirmed COVID or suspect COVID, and for the suspect COVID, should be in case she is to be kept there, she would have to be a strong suspicion of COVID. In the COVID care facilities, now some hospitals would have COVID care facilities and some may not, they would just have an isolation. The COVID care facility would have three demarcated zones: a suspect ward, a ward for confirmed patients, and then the labor ward and OT. So every suspected or definite positive pregnant woman will need to be triaged into one of these three zones. And in case a pregnant woman delivers in the non-COVID area and turns out to be COVID positive, she would have to be transferred to the COVID facility. So the key messages that I'd like to give here is we need to anticipate and prepare for COVID positive delivery. We need appropriate isolation and triaging of a COVID positive mother. We need to prepare ourselves for good infection control practices. This will be done in the next section. for the healthcare worker and for the mother. And we need to think and plan of strategies to protect the neonate from COVID. And the final message that I'd like to give is vertical transmission is known but is very rare. So the mother would need your reassurance to tell her that the fetus is unlikely to be affected.